Las Vegas, Brian Sonson will tell us about dexamethasone, a major breakthrough in reducing the death toll related to COVID-19.
Thank you, Alan. I just want to mention firsthand that there were nearly 100,000 cases of COVID-19 in the first 2 months of the pandemic. But in the past 2 months, there were 6 million cases reported. That's according to Director General Tedros of the World Health Organization during a recent press conference. But he also added that there are signs of hope that together through global solidarity, humanity can overcome this pandemic. One of the things he mentioned is that lab capacity has definitely been enhanced across the world to handle a significant amount of testing. For example, here in Nevada, we have increased testing from 80,000 a month ago to now over 227,000 as of today, which we now know is critical for not only identifying where the virus is, but also guiding and in a way commanding what steps our local government should put into place. Tedros also states that there is now enough data that they can use as good examples of many countries that have shown how to effectively suppress the virus with a combination of testing, contact tracing, and quarantining patients, as well as caring for those who are infected with the virus. And speaking of treatments, there was the welcome news of positive initial results from the recovery trial in the United Kingdom. Here's Director General Tedros talking about dexamethasone. Let's listen in.
Dexamethasone, a common steroid, has been shown to have a beneficial effect on those patients severely ill with COVID-19. According to early findings shared with WHO, for patients on oxygen alone, the treatment was shown to reduce mortality by about 1/5. And for patients requiring a ventilator, mortality was reduced by about 1/3. However, dexamethasone was shown to not have a beneficial effect for those with milder disease who did not need respiratory support.
This is indeed a very welcome news, as stated by Director General Tedros, and we definitely share his sentiment in the hope for more treatments that will result in better health outcomes for COVID-19 patients. And now I want to update you on Nevada United Roadmap to Recovery Plan. Nevada started in phase 2 reopening almost 4 weeks ago. According to a press conference held by Governor Sisolak just a few days ago, Nevada has seen an upward trend in COVID-19 cases, but it was an expectation as a result of reopening more non-essential businesses. But it has not shown a negative impact on the capacity of our hospitals and the use of ventilators across the state. Nevada's positivity rate, according to the COVID Tracking Project website, for the last week is holding at 5.2%. But Governor Sisolak states that they will continue to allow the medical experts time to monitor and make appropriate assessments of the available data. In late May, when Governor Sisolak signed the phase 2 directive, it was to extend up to June 30th to give them plenty of time to monitor the data and make responsible, medically driven decisions on how we go forward. As he has always stated during his press conferences, the virus is what drives the timeline. And he gave the reassurance that any decision made will be in the best interest of Nevadans in considering any future reopening. In closing, he stated that now is not the time to abandon the protective measures of social and physical distancing, as well as the wearing of facial coverings. If anything, we need to double down on these safety measures to stay open. In Las Vegas, Brian Sonson, Eagle News, we live in interesting times. Back to you, Alan.
Brian, what is the effectiveness of dexamethasone compared to hydroxychloroquine?
Well, I would have to say there is a distinct difference between those two medications, especially starting off with their clinical indication. Dexamethasone has already widely been used as a drug for patients who are suffering from respiratory complications like respiratory failure, a critical illness called ARDS, or acute respiratory distress syndrome. So this steroid or this drug is not new to the complications that we see in severe or acutely ill COVID-19 patients. Now, that might prove to be of good use to us because it has shown to decrease the mortality rate of COVID-19 patients who are on dexamethasone. When you compare that to patients who are taking hydroxychloroquine, now there's a distinct difference with that because that drug hasn't been proven and it has no clinical evidence as of yet to cure or to have any kind of positive effect on those with COVID-19. So that is the difference.
Well, that's a lot of information to take in, but we certainly appreciate the fact that you're able to present that to us. Thank you so much for that report.
Thank you, Alan.